Welcome to the Cryos webinar series. My name is Milagros Rete and I'm Clinic Account Manager at Cryos International Sperm and Egg Bank. This webinar is part of a Cryos webinar series. The webinar series consists of educational videos, which we hope will help you on your fertility journey. Today's webinar is called Facts about Fertility and How to Improve It, and it will cover both female and male fertility. We will be welcoming one of our own, Saghar Kasiri. Saghar specializes in clinical embryology and has an MSc in pre-implantation genetic diagnosis and fetal medicine, and over 25 years of experience working within the field of fertility. Saghar will present on female fertility first and then move on to male fertility. So without further ado, Saghar, welcome. The floor is all yours.
Thank you, Mila. Thank you very much. And hello to everyone who's watching this webinar. We will start talking and discussing about female fertility and what could be the causes of not being able to conceive. Female fertility and what could be the reasons behind some women not being able to get pregnant. I will just go very quickly through some general aspects of infertility, then discuss what female fertility is about and what you need to know about it, and also how you can increase your chances of getting pregnant naturally. We will discuss menstrual cycle and what is ovulation, and discuss some of the fertility tests you may need to do in case you have got issues with getting pregnant. And at the end, discuss what is available currently with infertility treatments. So, what is infertility really? Many women and that we speak to, sometimes they wonder if the delay in getting pregnant is actually a cause to worry about. Is it really infertility issues that they are suffering? In general, we say that infertility is if they have tried as a couple to get pregnant or conceive within the last 12 months, and they have tried at the right time of the month, and they have been unsuccessful. Now, this sometimes can become a worry because we expect that the first month that we try to get pregnant, that we will get pregnant. In actual fact, in animal kingdom, humans are the least productive species because we, at the best given time, are not very successful with our reproduction. And I will go through that soon. But before I discuss that, I just wanted to give you some idea about the real fertility data that we have available. World Health Organization has stated that 10% of the population of the world are actually infertile. There are many causes that can lead to infertility in a couple. It can be female related, it can be male related, or it can be a combination of the two. But sometimes, unfortunately, when we test both male and female, we don't come to any conclusive result of what may be the cause of their infertility, and therefore it's called unexplained infertility. In general, doctors divide infertility issues into two categories. The primary infertility, where someone has never conceived or never had a child, and it's the first time they've been trying, but they've been unsuccessful. Or secondary infertility, where someone has had one or more child or conception, but now is unable to get pregnant for a second or third time. So, if we have a quick look at female infertility, the most common causes of female infertility is polycystic ovarian syndrome, which I don't know if you can see my cursor in this presentation, but if you look at the two ovaries, sometimes those ovaries are filled with small tiny cysts that can interfere with us women being able to ovulate or ovulate regularly every month. Therefore, that's one of the most common reasons. The other common reason could be thyroid problems. Thyroid problems, either being overactive or underactive, can lead to infertility because they can cause imbalance in the hormone productions in our body. And that imbalance can lead to us not being able to produce an egg every month, or what we call ovulation. Another cause for it is premature ovarian failure, where the ovaries actually stop functioning before the age of 40. We women have a biological clock, as you may have heard in the past. And therefore, when we reach above the age of 40, our natural biological clock is telling our bodies about time to wind down. And the ovaries stop functioning as well as they used to do before we were 40. But for some women, this is not the case. And this process of the function of the ovary declining can happen sooner than the age of 40. So if we look at the background of what could cause the infertility in women, some other reasons that may be involved in causing the infertility may be the scarring that can be as a result of a surgery. So, for example, if you've had a pelvic surgery, it may cause damage or scarring to your fallopian tubes, which is where your ovaries link to your uterus. So eggs released from ovary need to come down the fallopian tube and enter your uterus. If there's a scarring in the fallopian tube, it can actually cause a blockage of this tube, and therefore the egg cannot reach to the uterus. And as a result, the sperm cannot reach the egg in the fallopian tube to fertilize it. Cervical surgeries can also cause a scarring and can cause the shortening of the neck of the womb, which can lead to infertility. Some women may suffer from thickening of the mucus in the cervix. The mucus that we produce in our cervix thins when the sperm is meant to swim through it and reach the egg in the fallopian tube. If women suffer from this thickening, that means it doesn't thin at the right time for the sperm to be able to swim through it. It can stop sperm from in its place and from getting to the egg. There are non-cancerous growth that are called fibroids as well. It is very common, and many women have fibroids. Where these fibroids are and how large they are can sometimes cause infertility issues. For example, if the fibroids are inside the uterus, where it would be the place for the embryo to be able to position itself and start the pregnancy, and if the fibroids are interfering with that, then that may be one of the reasons why women may not get pregnant. Another common reason is also endometriosis. Endometriosis is a condition where a small piece or small pieces of the womb lining can actually appear and grow outside the uterus or outside the womb. Endometriosis can be painful, it can cause a lot of bleeding, and usually it's picked up quicker because you see the side effects of it and can attend a physician for some tests and analysis. But unfortunately, endometriosis can sometimes cause damage to the ovaries and the fallopian tube and cause fertility issues. The pelvic inflammatory disease, or PID, is another cause of infertility for women. It can be caused by sexually transmitted infections or STIs, such as chlamydia, gonorrhea, and other sexually transmitted diseases. It can cause damage to the fallopian tubes. It can cause blockage, and the same issue that we discussed earlier may apply, where the egg will not be able to travel down these tubes. And unfortunately, it can lead to infertility. Some other causes of infertility are inherited disorders. It can be chromosomal abnormalities, for example, like Turner syndrome. Or it can be genetic disorders like fragile eggs. These inherited diseases are picked up by doing genetic analysis on the woman, and it usually is done with a blood test. Some women who've had children in the past or a child in the past and have decided to have a sterilization, if they find themselves with a new partner or decide later on in life that they want to have another child, may find that the reverse of the sterilization, where they need to open the fallopian tubes again, may not be successful, and that these tubes may be permanently blocked, and this can cause infertility. Some medication and drugs may also be responsible for the infertility issues. Side effects of some of these medicines will cause either problem with ovulation or stop you from ovulating completely. If you are on any medication and you have tried to conceive naturally and you have not succeeded for a while, you should discuss it with your GP, and look so that your GP can look at the medication you're taking to see if there is any effect on your hormone levels or the side effects of these medications are causing this issue. Some recreational drugs can unfortunately interfere with fertility and cause infertility issues too. So let's look at the lifestyle and how the lifestyle that we have can impact our infertility. Well, one of the most common problems we see with women who are suffering from ovulation issues is being overweight or underweight. If you are not within the normal body mass index or your BMI, and you're either overweight or underweight, you can suffer from some hormonal imbalance in your body. And if that hormonal imbalance happens, these hormones have an impact on each other and can interfere with your ovulation, your monthly ovulation that can take either a too long cycle or be too short cycle or cannot happen at all. We know other issues that can impact infertility are, for example, alcohol consumption and smoking. These can cause problems with the function of the ovaries, can cause oxidation in the ovaries and damage the quality of the eggs that you are producing. Of course, we've discussed a slide in brief about age. We women are born with the eggs we have. As we get older, our eggs get older with us, and therefore if you are reaching the age of 35 and beyond, that we will see a decline in that, not only the quality of the eggs but also the quantity of the eggs that we have in our ovaries. And when you pass the age of 40, there is a very steep shift in the quality of the eggs we produce, as well as the quantity of eggs that is remaining in our ovaries. As mentioned, illegal drugs and of course stress do have an impact. They can cause hormonal imbalance. We also see that excessive exercise or lack of exercise can also to some extent contribute to delaying getting pregnant. Therefore, lifestyle is very important part of your fertility plan. So let's give you some tips about improving your natural conception. Well, good nutrition is vital. Like any other organ in our body, we need good nutrition for our reproductive system as well. And therefore, it is very important that you eat the right thing or avoid eating or drinking food that can be damaging to your reproductive system. There is some research that shows antioxidant supplements will help, because one of the issues with the aging is the oxidative effects that we see in the ovary. That ovaries may age much quicker if we are not eating or we are not taking the right supplements that can be antioxidants, for example, rich in zinc and folic acid to help us maintain a healthy ovary. Taking multivitamins have been shown to also help, especially for women that have issues with getting the right nutrition in their body. Research specifically has been done on vitamin D, E, C, and B. Specifically, vitamin D is one of those vitamins that gets checked when you refer to an infertility clinic, because there has been a lot of correlations between vitamin D and producing healthy eggs. Exercise, but not too much. Too much exercise can actually have an encounter effect on producing eggs, healthy eggs. Managing stress levels, as mentioned previously, and being overweight and underweight. If you can maintain a healthy lifestyle and control these parameters and keep them without a stable, healthy state, then you're definitely helping your conception. So, just to give you some idea about what it is that's so important about hormones that we discussed earlier, let's learn a little bit more about the menstrual cycle. Well, menstrual cycle for women is different from one woman to another, but on average, it should last about 28 days. And we can divide it into two phases. The first 14 days is called follicular phase, and the second phase is called luteal phase. There are four major hormones that play a role in your menstrual cycle: LH, FSH, estrogen, and progesterone. As you can see in this graph, you don't need to worry too much in details, but just wanted to show you how the movement and the level of these hormones can impact your ovulation cycle. They are working interdependently. Rising of one can impact the level of other hormones. So they are very interdependent, and that's why we were talking about healthy eating and healthy lifestyle, because it can impact one or two of these hormones, which then has a knock-on effect on the other hormones. In general, they change through your cycle, as you can see, and the change that they are going through, the levels of change that we see in these hormones, can make ovulation happen. So around the day 14 of the month, we are expecting an egg to be released. Some women, this may be earlier than day 14. For some women, it may be later than day 14. So if we want to look at it in more details, in this diagram, you see how a primary follicle, which is a sac that the egg sits in, develops from day 1 of your cycle, which is the first day of your period, all the way to day 14, where this follicle grows and matures, and the egg grows and matures within it, and then it's released. And that's when the ovulation happens. And then what is remaining from that follicle is what we call a corpus luteum, which then goes on for the next 14 days, getting itself ready for a pregnancy by releasing a hormone called progesterone. What is important to know is when is the best time for conception during this period of ovulation. The best time for conception is 3 days before you release an egg, and then 12 to 24 hours after you've released the egg. The reason for this is that it's been shown that the sperm can live inside a woman's reproductive tract for up to 3 to 5 days. And the egg will live for around 12 to 14 days. 12 to 24 hours after being released. So therefore, you can see that if you have an intercourse 3 days before the ovulation, up to 24 hours after the ovulation, that gives you the best chance for getting pregnant naturally. Women who are not pregnant, who are pregnant may not ovulate. Women who are breastfeeding may or may not ovulate, and women who go through premenopause or after menopause do not ovulate. Therefore, through puberty all the way to premenopause, women should be ovulating every month, but this may not happen for all women. And this is what needs to be investigated when you visit your GP and or if you visit a fertility clinic. So this leads us nicely to see what tests can actually be done for you if you visit a clinic. Well, perhaps one of the very first tests that they do for you is a range of blood tests to check your hormones, to check LH, FSH, progesterone, estrogen, as we discussed earlier, because they do have a crucial role in helping you to ovulate. Other hormones that are very important is what we call AMH, or anti-Mullerian hormone, or thyroid hormones. They can impact your fertility if there is an imbalance in this hormone, or there is too much production or too little production of these hormones. Chlamydia is another test. Chlamydia and gonorrhea actually are other tests that can be done when you visit. Chlamydia is one of those infections that cause PID that we discussed earlier, but there is silent infection. That means you may be infected. It could be chronic. It could be affecting the tubes, the fallopian tubes, but you will not have side effects to know about it. So therefore, it is very important that the health of the reproductive system gets checked when you visit a clinic. Another way to check the health of your reproductive system is by ultrasound scan. We can check both ovaries, we can check the uterus, and we can check the fallopian tubes to make sure that they are healthy. A more detailed scan can be done, called hysterosalpingogram, which is by sending a dye to make sure that the fallopian tubes are open, and that if you are ovulating, that the egg can actually travel down and meet the sperm in the tube and be hopefully fertilized, and then be able to get to the uterus and position itself ready for the pregnancy. If you may be suffering from endometriosis, the way to find out, sometimes the doctors may have to do a procedure called laparoscopy to check that if you have endometriosis and at what extent it is, and whether it can be treated by medication or surgery. One of the important tests that we do when you attend a fertility clinic is an antral follicle count. It gives an idea of where the fertility stands in relation to your age. It's purely counting the number of those follicles we discussed in your ovary. Perhaps something I should explain at this stage is that we women are born with the follicles or the eggs that we have. We don't produce new ones after birth. So what we have is our reservoir for our whole life. From puberty onwards, every time you ovulate, you lose around 700 to 1,000 follicles. So 700 to 1,000 follicles start activating, egg starts growing inside them, but one of them wins the race and makes it all the way to maturing one egg, and the rest naturally disintegrate and get reabsorbed in the body. So therefore, every ovulation, every month, we lose a huge number of follicles from our ovaries, and hence why by the time we get to the menopause age, we sometimes see that, not sometimes, but very likely, you see a reduction of the number of follicles. In this test, we will count the number of your antral follicles, which is pre-getting matured, to find out how many you have and what relation they have with your age. It identifies the primary ovarian insufficiency, if there is any. It can help us see if you've got any issues with polycystic ovaries, and it also helps us to evaluate what is your ovarian reserve. So these follicles that are filled with the fluid and they are sitting inside your ovaries are a good indication of what could be the current health of your ovaries and the function of your ovaries. We find that this test is done very well if it's combined with another test called AMH, or anti-Mullerian hormone, that I mentioned earlier. The two of them together can give us some indication of the reservoir of the eggs you have left in your ovaries. there is a correlation between AMH and age of women. As you can see in this graph, as we get older, the level of this hormone starts reducing in our body. So measuring the AMH via the blood test and doing the antral follicular scan, together the combination of the two can indicate to us what is the status of the function of our ovaries. AMH can be done on any day of the month. Usually FSH and estradiol are done on the second day or second to the fifth day of the month, but AMH can be done at any day of the month with a blood test. So, in case we find an issue with the female fertility, there are a number of ways to actually be able to treat these issues. Perhaps the first thing that you notice the doctor will try and assist you with is to give you medication. Clomiphene, tamoxifen, metformin, and gonadotropins are the most common medications that are given to women. And most of them, their function is to regulate your cycle and regulate your hormone levels. If medication fails, then or we may find that there is other issues that is impacting your success of getting pregnant, then surgical procedures may be used. For example, your fallopian tube may need a surgery. If it is partially blocked, they may try and open this blockage. Or if you are suffering from endometriosis or very large fibroids positioned in the wrong place that is impacting you getting pregnant, they may be able to help. And the same for polycystic ovarian syndrome. If medication and surgeries fail, we can proceed to assisted reproductive technologies or assisted conception. And one of the very first treatments that is usually offered is what we call intrauterine insemination, or IUI, where sperm is taken from your partner, is purified in the lab, and then inserted into your uterus at the right time of the month when you're ovulating. Another procedure called IVF, in vitro fertilization, may be used if IUIs fail. And if there is a male factor infertility also involved, instead of IVF, we could actually do ICSI, or intracytoplasmic sperm injection. Now, many people ask about assisted reproduction success rate. And many people who are going through the process of infertility seem to get very disappointed with the success of fertility treatments. Many patients think that 80% chance of getting pregnant through IVF is the norm, and anything less than 50% of getting pregnant is actually not successful. In actual effect, as mentioned before, we are not very strong with our reproductive system as humans. And even if you have two healthy people, a couple that are healthy and young, their chances of getting pregnant naturally is only around 20%. So you can see that when IVF techniques can provide with 40%, 30%, or even 50% success rates, they are actually beating nature in a sense. In 2018, it was found that on average, birth rate per embryo transfer for IVF patients was 23%. This obviously varies from clinic to clinic. If you are looking at IVF clinics, you must be very clear about what parameters they are mentioning on their website. For example, is it birth rate, or is it clinical pregnancy? Is it birth rate per embryo transfer, or is it birth rate per cycle? These variations make a difference in the percentage that you are seeing on the website or when you talk to the doctor. You must always investigate it and find out how these statistics can help you and for you to assess which clinic would be the best clinic to attend. In general, for under 35-year-old women, 31% pregnancy rate is what is being seen as a norm. With age, this pregnancy rate drops significantly, and for women over the age of 43, it can actually drop to less than 5%. And this is one of the reasons why when you attend clinics, IVF clinics, if you have tried a few times with your own eggs to get pregnant, IVF treatments, or if you are at an age that your fertility has declined due to having less eggs or poorer quality eggs, then you may be offered egg donation to proceed and to help you with getting pregnant. So, what is egg and sperm donation? There are two types of gamete donation, egg donation and sperm donation. I will very briefly focus on the egg donation for this talk. Just to mention that the sperm donation is for men that have got poor sperm quality or no sperm at all, and that we can provide sperm donors that are healthy to use. Some men may have a sperm but may have hereditary diseases or genetic diseases that they can pass on to their offspring, and therefore they can use a sperm donation. On to egg donation now. This is used for female infertility issues, cases where a woman cannot produce their own egg or they produce very poor quality egg. Advanced maternal age, low ovarian function, premature menopause, treatment with cancer in the past, they can all contribute to women who may not have enough eggs of their own or have very poor quality eggs. And in this case, the assistance of gamete banks come into place. For example, Cryos International, we provide egg donors, and our egg donors are from healthy women from the age of 18 to 32 who can produce good quality eggs and who are altruistic donors that can provide their eggs that can be used for patients that need egg donation treatment. Most of these young ladies, they have some level of higher education. They meet both the physical and psychological assessments that we do through massive screening that's done to make sure they're suitable as donors. The extensive screening that we do on these ladies has meant that we only have 4% conversion rate. That means from 100 applications we get at Cryos International, we actually process them, and only 4 of those 100 applications make it all the way through to egg donation and to freezing of their eggs. Some of our patients that contact Cryos International have queries about fresh eggs versus frozen eggs. We can speak about this in another webinar because obviously it's a good subject to cover. But just to tell you very quickly that freezing eggs is an expertise of Cryos, and we have successfully developed a program that can freeze and thaw eggs very successfully, and our frozen eggs are comparable very much with the fresh egg cycles that you may receive from fresh egg donation. If you have been investigating fresh egg donation, you know that you need to have a cycle that's synchronized with the donor, and therefore that can cause some complications sometimes through the donation. Whereas if you have frozen eggs available that you can just purchase from a bank, that is a much quicker service, and the quality of the eggs are just as good as for fresh eggs. Results are improving. We see more women are doing treatment with frozen egg donation cycles. I hope you have enjoyed this presentation, and I wish you best of luck. And I don't know if we have got any questions at the moment.
Thank you, Saghar. I guess a common question that we get from our viewers is for a couple who have been trying for a while to have a baby and they haven't succeeded, when would be a good time to say, okay, now we need to see a doctor and see why we haven't succeeded in becoming pregnant? When would that time be, more or less?
A very good question, and a very common question that is asked. Basically, if you're under the age of 35, the advice is that you should try for 12 consecutive months to get pregnant. And therefore, if you haven't succeeded to get pregnant within 12 consecutive months, and of course, with the right knowledge of when you're ovulating in the month, which is very, very important, because if you have intercourse in the first 7 days or the last 7 days, the likelihood of getting pregnant is not a lot. As we spoke, that it's around the day 14 that you ovulate. So therefore, if you have consecutively been trying to get pregnant for 12 months and you haven't succeeded, the advice is to, of course, seek advice from your GP, discuss, your situation, and maybe have some primary investigation done. Some doctors actually advise, if you're under the age of 35, you can wait up to 2 years if you wish to do so. But if you are above the age of 35 or getting very close to 40 or 40 plus, you shouldn't wait this long, because for every month you're ovulating, you're losing a large number of follicles. And therefore, this delay in seeking assistance from a physician or a fertility clinic, it can actually cause problem in the future if you decide to even go down the route of IVF. So the advice would be, if you are above the age of 35, and especially if you're above the age of 40 and you haven't succeeded in getting pregnant, say within the first 6 months, then definitely seek advice from the doctor.
Okay, thank you. So now we can move on to the second part of the presentation.
So this second part is discussion on male fertility and what can be the causes of male infertility. In this webinar, I would like to discuss about male fertility, what may cause male infertility, can environmental factors, health or lifestyle have an impact, what is the semen quality, and how can we increase chances of natural pregnancy. And of course, if you are suffering from any male infertility, what treatments are available for you, and whether donor sperm should be a treatment you would be considering. So male fertility is a very complex process. And in order to be able to achieve a pregnancy, firstly, you must be able to produce healthy sperm. And once you've produced that healthy sperm, that sperm needs to be carried out into the semen, and from there to be able to leave your body. The sperm must be functional. It must also be able to move well, and we will discuss that in more detail further on. If in case there are any issues, what could be these issues that can cause male infertility? Well, one of the very common issues with male infertility is what we call varicocele, and you may have heard this, is actually swelling of the veins that drain the testicle. They can be similar to the varicose veins we get in our legs, but this actually happens inside the testicles. And what will varicocele do is that it leads to the sperm quantity and quality being reduced. Men who have this problem may experience some pain and may see the varicocele itself, and they should definitely refer and see a urologist to get help and advice on how to treat it. The other cause of infertility is infections. Some can interfere with the sperm production if you have an infection, especially if the infection can get chronic and has been there for a long time. It can interfere with the sperm production. It can also interfere with the health of the sperm itself. It can cause scarring that blocks the passage of the sperm. So it blocks the sperm being able to move from its production site to get to the semen. It can cause inflammation of the epididymis, which is the tubes that the sperms travel within the testicles, or they can actually cause inflammation of the testicle itself. Some men may experience ejaculation issues, what we call retrograde ejaculation, when the semen, instead of leaving your body, actually enters your bladder during the orgasm, and therefore it cannot emerge out successfully. There are other conditions that can cause retrograde ejaculations, some underlying conditions and health issues like diabetes, spinal injuries, sometimes some medications may cause it, or surgery of your bladder or prostate or urethra may be the cause of it. Other issues that can cause a problem with the actual sperm when it leaves your body is what we call antibodies that attack your system, or sperm antibody syndrome. The sperm mistakenly identified in your body as a harmful and perhaps even a foreign object, and therefore your own body attacks the sperm you're producing and tries to eliminate them. What will happen is that the sperm that's produced will have antibodies in it that makes the sperm stick together and doesn't allow the sperm to swim well, and therefore when it's deposited inside a woman's reproductive tract, it cannot swim and make its way to the egg. Some tumors may impact your reproductive organs directly. Some tumors of the reproductive organ, or sometimes the tumors may be somewhere else in the body, for example, on the pituitary gland, that can impact the release of the hormones that are needed for the sperm production. Some children may be born with undescended testicles, and if this is the case and these testicles are not, with the help of surgery, are not removed from inside the body, later on in life they can cause problem, because testicles that were undescended and have stayed inside the body for longer than 6 months to a year, unfortunately cannot produce healthy sperm. The reason for that is the testicles are outside the body in men because they need to be 2 degrees lower temperature than the 37 degrees of your body. And therefore, if as a child, when you were born, you had undescended testes that have not been, with the help of surgery, removed from the abdomen and taken out, it can permanently damage the tissues of the testicle and stop sperm production. Some hormonal imbalance may also be the cause for lack of production of sperm, or of course, the sperm being produced normally, but also sperm being produced in a level that can be taken out of the tubules into the semen. So these disorders and abnormalities of the hormonal system, for example, low testosterone levels, can impact both the production and the quality of the sperm you produce. As mentioned previously, if there is defects in the tubes that allow the sperm to travel down your body, this can cause a problem of blockage or partially blocked, and therefore the sperm cannot make its way to the semen. These tubal defects can be caused by injuries that may be sport injuries. They may even be injuries due to surgery that you may have had in the past. It could be some chronic infections you may have had, or just an abnormal development in the body. Some chromosome defects can also, unfortunately, cause male infertility. These can be inherited diseases like Klinefelter syndrome. They cause development, abnormal development of the reproductive system. Some of them may be genetic and cause problems with the actual ability of your sperm to fertilize an egg. For example, cystic fibrosis or Kalman syndrome. Other problems that cause male infertility may be sexual intercourse related. What this means that it could be due to erectile dysfunction, it may be due to premature ejaculation, it could be due to painful intercourse with your partner, or it could be an anatomical abnormality. It could also be a psychological problem. And if this is the case, please see the GP, discuss with the GP. If it's a psychological problem, it's something that can be sorted by the help of a psychologist, but in any case, they can lead to infertility issues in a man. Medications may also be a cause of male infertility. For example, men who are having testosterone replacement therapy, those that take long-term anabolic steroid use for bodybuilding, for example, because they reduce the normal production of your own testosterone in the testicles, and therefore they can stop the production or reduce the production of sperm in your body. Men who've had chemotherapy or even radiotherapy due to previous cancer, and some men who have got ulcers or arthritis and are taking special medication for those. If you've had prior surgeries like vasectomy, for example, you had a child previously and you decided that you did not want to have a child anymore and you had vasectomy, vasectomies can be reversed, but sometimes when the duration between the actual vasectomy and the reversal is for too long, it can cause permanent blockage of the tubes and therefore makes it harder for the sperm to make its way to the semen. So testicular surgeries, prostate surgeries, and vasectomy can be causes of infertility issues. So beside these psychological or physical problems that can cause infertility, some environmental factors have been correlated to increasing the risk of having infertility in men. Overexposure to certain environmental elements such as heat, toxics, chemicals can reduce either the production of your sperm or the actual function of the sperm. To name a few, industrial chemicals for men that work in industries that are exposed continuously to certain chemicals, this can impact the production or the function of their sperm. Exposure to heavy metal, for example, mercury, exposure to radiation or X-ray, as mentioned before, if you've had radiotherapy, for example, as a result of cancer, that has meant that this radiotherapy has been exposing your reproductive organs and it can impact it. But going back to what we discussed earlier about overheating the testicles, saunas, hot tubs, if men stay for too long in saunas or hot tubs more than a few times a week, it increases the temperature of the testicles and can damage the sperm that's being produced or lower the production of the sperm. As mentioned, testicles are meant to be outside the body and kept cooler at least 2 degrees lower than the body temperature for the optimal sperm production and function. So long periods of sitting down in tight clothing, it's been researched that it may have an impact. Also working with the laptops that heat up on your laps, there have been some reports on that as well. So if you are doing even exercises that for a long period of time is heating up the area around the testicle and taking the temperature up, this may have an impact on the production and function of the sperm. Other factors are, of course, health and lifestyle causes that can lead to reduced function or production of sperm, such as drug use, such as alcohol, excessive alcohol use, smoking, and of course being underweight or overweight have all been correlated to reducing the potential of fertility for men. So we've talked about reducing the quality and the quantity. So let's have a quick look at what it is that we need to check in a semen to know that it's a normal semen that a man is producing. So there are two ways of measuring sperm or the semen. The sperm can be measured with regards to its quantitative assessment or the qualitative assessment. So the quantitative assessment in a semen we look at is, for example, the volume of the semen that's produced, the concentration of the sperm that's inside that semen, the total number of sperm that are motile and live, which can be quite important to see if we are checking for issues of infertility. But also the qualitative studies are important. For example, looking at how well the sperm is swimming, and is it going the right direction? Is it swimming in a linear motility, has a linear motility and swimming in a straight line, or is it a sperm that is swimming all around itself? Because if that's the case, that sperm would have difficulty to try and make its way to the egg inside the woman's reproductive organ. We also look at what we call morphology. Has the sperm got a healthy head, a normal head, a neck and tail to be able to swim well? And we will also look at something called DNA fragmentation, which is to find out whether there is damages, and sometimes the heat and oxidative stress can cause increase in DNA fragmentation. If a man suffers from having a high DNA fragmentation in their sperm, it can lead towards reduced fertility. It can lead to embryos not being produced in a healthy way, and therefore can also lead to lack of implantation of those embryos or even miscarriage. So let's look at what is good and bad sperm. For many years, World Health Organization has been assessing what they call a normal population of men who've not had issues with conception, to analyze the quantity and quality of their sperm, to find out what should be the reference and the parameters we look at, and the reference values that we can use in the lab to assess men's semen production and the quantity of the sperm they have. As an example, after looking at thousands of men, the average semen volume that was suggested that it should be more than the volume that we get is 1.5 mil. So if a man produces more than 1.5 mil, we call it normal semen volume. The number of total sperm, for example, should be more than 39 million sperm. Motility should be more than 40%. That means that motility is the live sperm that is swimming around in the sample. And for example, the sperm morphology should be more than 4%. So if we have got a problem with the head of the sperm, the neck of the sperm, or the tail of the sperm, all of these can cause issues with leading to infertility. So if the parameters are not within the range suggested by WHO, then that is the first sign that maybe we should be looking at what are the causes of infertility, how we can improve it, and whether infertility treatments would be needed or not. And again, another parameter that mentioned previously is the DNA fragmentation index, which the higher reference is 30%. And therefore, if there is an issue with the DNA fragmentation, we definitely need to think about how we deal with the cause of it. And if we can deal with the cause of it, and if not, proceeding with IVF or ICSI treatments, which is the assisted reproduction treatments. So if we wanted to naturally increase our chances of getting pregnant, how can a man help himself to produce better quality and quantity of sperm? Well, first of all, we know that the smoking has a detrimental effect on the production and the quality of the sperm. So if you are a smoker, please consider stopping smoking. Limit the alcohol, limit or actually abstain from taking alcohol if you are during the period that you're trying for having a family. Stay away from any recreational drugs, illicit drugs. Maintain a healthy weight. If you're underweight, you need to bring your weight to a healthy BMI. If you're overweight, you need to reduce the weight. Avoid things that lead to prolonged heating of the testicles, as mentioned earlier. Try to reduce the stress levels. They can have an impact on the hormones, and the hormones will impact the production of the sperm. And avoid exposure to pesticides, heavy metals, and other toxins that mentioned previously. We suggest that if you increase your activities, for example, exercise, and avoid this unhealthy lifestyle. If you manage to proceed to a healthy lifestyle for at least 3 to 6 months, we can see an increase usually of quality and the quantity of sperm that is produced. Now, if you've been diagnosed with having infertility issues, there are a number of ways to help this process to increase the chances of pregnancy. For example, if you are suffering from having varicocele and it's been diagnosed by a doctor, then the possibility is they might use medication or surgery to correct the obstructed vas deferens or the tubes that transport the sperm. If you've had prior vasectomy, as mentioned, you can reverse it, and sometimes it can be a successful reverse of the vasectomy. If you have issues with full obstruction or partial obstruction where the sperm cannot be able to leave the tubes, then other procedures are available to actually remove the sperm from higher up in the testicles. They can be and in the epididymis. So they can actually, with a very minor surgery called TISA, PISA, be able to remove this sperm from your testicles. If you have suffered from infection, which has caused, for example, problems with the reproductive tract, then needs to be investigated. Sometimes if the problem is not chronic, it may be able to be restored with medication. And therefore it is very important that if you have any reproductive tract infections, that you get help as soon as possible and do not allow it to become chronic. If you have got problems with sexual intercourse, medication or counseling can help and improve the fertility. For example, conditions such as erectile dysfunction or premature ejaculations are treatable, and therefore it's the best advice is to seek assistance from a physician or your GP as soon as possible. There are hormonal treatments and medications available. If there is hormone imbalance, you can go on hormone replacement therapy or medications where infertility is caused by hormone imbalance can be to some extent cured. And the physician will look at the root of the problem. Where is this problem initiating from? And can hopefully with medication help you with that. If these treatments don't work, then of course there's assisted reproduction technologies that are, or ART, that are available for use. If the problems with the sperm is not severe, then, as mentioned, for the female fertility section, you can actually use a technique called IUI, where if the parameters of sperm quantity and quality are not too far away from the normal parameters, they can be purified in the lab and used as a purified form of sperm and injected inside a woman's uterus at the right time of the month. If the problem with the sperm parameters are more severe than either IVF or in the case of severe male infertility, intracytoplasmic injections can be used to assist. And ICI, or intracytoplasmic sperm injection, or ICSI, has actually been very powerful in helping male infertility. It's actually revolutionized the issues we have seen with male infertility, and it's been able to assist many couples to achieve the dream of having a child. Now, if all fails and we will not be able to use your own sperm for treatment, then there is, of course, the option of donation. The sperm donation is available. So a bank like Cryos, who's been around for over 33 years as a sperm bank, has many sperm donors available. The choice is varied, and what we find is majority of the patients that refer to us use very successfully and have achieved the pregnancy through donation process. Now, who needs a sperm donation? Of course, heterosexual couples that have male factor infertility, just as we discussed earlier. We have also same-sex couples that use a sperm donation, and we also have single women, either heterosexual, or homosexual, that actually use sperm donation. In Cryos, what we have noticed, and the data we have collected is showing us that 18% of the couples that actually come to us for a sperm donation, they're in heterosexual relationship, 35% are in same-sex relationship, 43% are single heterosexual, and 4% are single homosexual. Just very quickly, let you know who the donors are. The donors are between the ages of 18 to 45 years old. They are psychologically and physically healthy. They get assessed on both psychological and their physical profile. More than 50% of them are in a relationship. More than 50% are pursuing higher education or are in employment. And 50% of our sperm donors are actually blood donors. So donors are donating due to altruistic feeling that they have to help, they want to help other couples to achieve their dreams of having a child. We are very, very strict with our screening processes. We screen vastly for physical and psychological parameters, and make sure that the donors are healthy. And as a result, only 5 to 10% of our applicants actually make it all the way through to donation. Now, one thing just before we end is to be aware of what we call a gray market. With the sperm donation, unfortunately, there is on the internet or other places available some unofficial sperm banks where individuals may offer to give their sperm sometimes for exchange of money. This is an entirely underground activity, and you must be really aware of this, because there is no level of screening in majority of the time. So they don't get a screen, for example, for infectious diseases, for genetic diseases, the health of their mental health, and so on. And also, this could obviously mean that there is a higher risk of sexually transmitted diseases that you may not know that can be transmitted through using their sperm. And of course, there is a possibility of legal complications. So please be aware about this gray market. I hope you have enjoyed the talk. Thank you very much for staying with us so far, and wish you all the best. Back to you.
Thank you so much, Saghar, for such informative presentations, both of them. One question we get a lot of is when it's the male partner in a relationship that is discovered to have fertility issues. They often suffer alone. They are called the silent sufferers. And what resources could there be out there for men who discover that they have fertility issues?
Yes, of course. I think one thing to mention is all the issues, obviously, that I have mentioned during the talk about infertility for men. It's very important to mention that most of these issues can be treated. And it's a common knowledge that men find it more difficult to attend GPs or see their physician because they are worried that it could be something that is their fault, and therefore feel embarrassed to go and see a doctor. And this can complicate and delay the process of conception, either naturally or with the help of infertility treatments. The advice is that there is so much treatments that are available for all the issues that we have mentioned, that most of these issues are treatable. And therefore, by not going to the doctor, they are delaying this process for no reason. They are called the silent sufferers because unfortunately over the years, and infertility treatments have been around for many, many years, as you know. For some reason, of course, the more focus has always been traditionally on a woman. When a woman goes to a doctor initially and says, I'm trying to have a child and I've not succeeded, the initial focus has always been to test her for various things: physical assessment, hormones, all the things that we talked in the first webinar with regards to relation to the female fertility. It's very sometimes late in the process of investigation that they called the partners in to do the assessment. But more and more doctors and clinics are now making it routine that if a couple is suffering from conceiving, they should ask both partners come in for initial assessment. And instead of investing so much time on just the female, they can actually get both partners tested. But even if after the testing, again, because the woman has to go through perhaps some treatments and receive some hormones in order to produce more eggs, to go through the IVF or AC process, the man just seems to stay on the sideline, and the role is only to produce the sperm. And so, they are called the silent partner. They suffer just as much as a woman does through the whole process. The pain, the stress, and sometimes the letdown of the treatments when they don't get pregnant first or second round, this impacts the men just as much as the women. And therefore, there has been in the last few years more call for men to voice it, more call to the IVF clinics and the reproductive field to not ignore the crucial role the man has, and most importantly, his psychological support and help. If you look on the websites, you find a huge number of platforms available for women to discuss about their issues, to discuss their concerns, but there hasn't been many support forums for men. Well, luckily, more and more is coming along. Cryos has actually co-founded a website that is a forum that can help men, and it's called All About Fertility. And I advise our our lovely viewers of this webinar, if they can go there, and they will see a lot of information, not only on the female side, but a huge amount of information for the male side. But they shouldn't be silent sufferers. They should seek advice from GP. They should seek advice from a counselor, and be supported through the whole treatment.
Thank you so much, Saghar. It's been a pleasure to have you. And
Thank you.
I thank you on behalf of all our viewers as well. Thank you.
Thank you very much.